This is Chicago's very own WGN News at 9.
On the Medical Watch, a transplant that keeps professional athletes in the game works the same way to keep regular patients on their feet. For young adults not yet ready for joint replacement and who can't go the distance living with debilitating pain, donor cartilage comes into play. It's about the size of a quarter, an intact, healthy piece of cartilage orthopedic surgeon Dr. Brian Cole will transplant into his patient's knee.
I'd like to pull this bone graft out of here.
The procedure is called osteochondral allograft, but before Dr. Cole could do the surgery, he needed donor tissue. Think of it like an organ donation.
This cartilage is alive, the bone is alive, and we're going to use a small cylinder of cartilage and bone taken from this graft.
Someone who would otherwise donate their heart, liver, and lungs also donates their cartilage. Typically, they're very young donors. Most of them have died in traumatic accidents and things of that nature, but we utilize their cartilage to treat local spots of arthritis.
Once the donor cartilage is tested and deemed safe for transplant, a process that takes about 14 days, the graft is pressed right into the defective area. It's not a new concept, and the surgical intervention is rare compared to the number of joint replacements performed annually. Still, with about 2,500 to 3,000 grafts performed each year, surgeons now have a larger collection of outcomes to consider.
We have about an 85% satisfaction rate with conditions that are lasting up to 10 to 12 years now.
That means the graft is often an effective bridging technique, particularly for a select group of patients with cartilage loss who are too young for total knee replacement.
When this goes well, we don't worry about them going back to very high-level activities. No restrictions whatsoever, even professional sports. In contrast with metal and plastic, that's just not an option.
She's not a professional athlete, but Kirsten Kent's knee once threatened her career in the same way. On her feet for long shifts at Shriners Hospital for Children in Chicago, the constant pain limited her ability to do the job she loves.
It was really hard. At work, I wouldn't be able to move around much. I pretty much was stuck in my office, and I would try to do as much as I could, but I kept telling people, I'm not lazy. I just have so much pain, I can't really move around. I wasn't able to help with helping other coworkers with their tasks for the day, and I would really limit where I would go. I wouldn't go grocery shopping at night. I wouldn't be able to go out and do anything. I would just basically sit home because I was in so much pain.
Normally, this would be covered with white, glistening cartilage. She had an area of cartilage loss behind her kneecap where the bone was exposed, and then the groove that the kneecap tracks in was also had exposed bone. We took this donor's patella and transplanted into her knee, and then the same thing for the groove that the kneecap tracks in.
It was a calculated risk. Kirsten was nearly too old for the allograft. The transplant works best on younger patients who don't have the arthritic changes and degenerative disease that often come with age. But Kirsten and Dr. Cole were willing to take a chance.
What we're learning is that if we push the envelope, many of these patients can also be helped with the same technologies we apply to our other age groups.
But I was told that I was too young to get a knee replacement and that I would need too many revisions down the road. So really this was my last option. I feel really, really good. I keep saying I never thought that I would see this day.
Unlike an organ transplant, cartilage transplant patients don't need to take anti-rejection drugs. Recovery takes about 3 to 6 months, with most patients back to full activity after 8 months. Back to you.